Successful Minds with Patricia Barnowski-Schneider, the show that takes you around the world to share interviews with some of the most successful and relevant people on the planet. Hear their stories and get the most important business lessons they have learned on their road to success and get exclusive advice on how to implement their success into your life and business. Successful Minds with Patricia Barnowski-Schneider is brought to you by the Strategic Advisor Board and your host, Patricia Barnowski-Schneider.
Hey, are you looking to scale your business from 5 figures to 6 figures or 6 figures to 7 figures? If you are, I have the perfect thing for you. What I want you to do today is I want you to go download a book. This book is going to take you through my 3-pillar system. It's 100% free. All you have to do is go to growfast.cash. I say again, go to growfast.cash and you're going to be able to download my free international best-selling book, which is called Be Good, Be Brief, Be Gone. You can take that book. It's going to help you scale your business to the next level. Again, go download it. Be good, be brief, be gone. Growfast.cash. I say again, growfast.cash. Enjoy.
Hello and welcome back to Successful Minds. I'm your host, Patty Baranowski-Schneider. Today I'm joined by Pornima Mhatray, a medical doctor dermatologist. So welcome, Pornima. Tell us a little bit about yourself.
Hello. Yes, thank you. Thank you so much, Patricia, for having me on this podcast.
My pleasure. So tell us a little bit about yourself.
Yeah. So, Patricia, I'm a medical doctor in India, and I'm practicing for more than 3 decades.
Wow.
Yes.
So you know what you're doing, apparently.
Absolutely. And so I've been practicing dermatology and majorly medical cosmetology. That's aesthetic medicine.
Okay.
So we deal with the skin problems, aging, hair problems. We also treat for the weight and the fitness. Yes, and to lose weight, also to reverse diabetes, to reverse hypertension, means to treating all kind of lifestyle diseases. We do a lot of, a wide range of cosmetic surgeries as well. That's rhinoplasty, blepharoplasty, facelift, also liposuction, tummy tuck, liposuction on the thighs, liposuction on the arms, back. So in short, we do all these kind of services. We have 2 clinics in the city called Bombay or Mumbai. I'm sure you must have heard of it. Yes. So we have 2 centers over here. And that's nice. What, yes. And we majorly treat lifestyle diseases and try to reverse them by making changes in their food pattern, food timings, also counseling them for fitness, for to be there at the target weight or around their target weight, so that they don't have to face conditions like diabetes and conditions like hypertension, and so that they can age healthy.
Very nice. I'm sure you have a big client list. So can you tell us,
we do.
Being you have an extensive background in medical cosmetology and wellness, so can you share your journey or what inspired you to specialize in these fields?
Yes. It is very funny, but since the time I was a kid, I always wanted to be a medical doctor. Yeah.
Oh, that's good inspiration.
Yeah. So I had been studying for that, and that's how I completed my schooling, then my college, and then the university. And that's how I became medical doctor. And my passion was always dermatology and medical cosmetology. For quite some time, for a few years, I have also worked in USA and Canada as well. Wow. So there I honed my skills majorly for cosmetic surgeries. And that's how, and after my college, I worked for a few years in few hospitals, and after that I started my own practice. So I have been an entrepreneur also for quite a long time in my life.
Wow, good for you. I always admired people who said that they know what they want to be when they grow up. I always still say, I
Yes,
still don't know what I want to be.
that's great. That is also good, so that you can explore many
Oh,
forms
I'm
of
getting too old for
careers.
this at
Yeah.
this point, but yeah.
Yes. Yeah.
Now tell us,
Yes.
medical cosmetology, it's evolved significantly over the years. So what are some of the
Yes.
latest trends and innovations that you find most exciting in the industry?
Yes. So now latest trends are definitely Botox has been there for quite some time. There is fillers, there are laser treatments. Latest trend I would say is the IV therapy.
Okay.
Uh, I'm sure you have heard of it. So IV therapy comprises of infusion of multivitamins.
Right.
Also, it's a vitamin called glutathione, which is a derivative of vitamin C, and that helps you to keep IV therapy helps you to remain hydrated, nourished. Most importantly, and most importantly, when you are aging, it also helps to keep your liver clean, all your internal organs clean. For sports, people who are in sports and gymnastics, also it helps them to endurance, to increase their endurance, to boost their stamina, to
Right.
boost their immunity. And people, and especially for women like you and me who are menopausal, it helps them in a great way. It because it helps them as their stamina is maintained, their mental health also remains quite fine. And yes, and that's how see, when you are aging, you should age healthy. Your aging should not be painful, or it should not be what you say, cumbersome or troublesome for you. My
Right.
joints are hurting now. Today I don't feel like getting out of my bed, so
Right.
that should not happen. Yes. So IV therapy plays a major role over there, and that's the latest trend in medical cosmetology, but also in lifestyle diseases. Also, for people like us, for brown people,
Mhm.
and from the other side, it also does skin lightening, also helps you to clear your pigmentation or your melasma. So that is, yes, so that is the, I would say, is the latest trend in the aesthetic medicine.
Wow, they got pretty much every part of your body can be fixed nowadays.
Yes,
Wow.
yes.
Well,
Yeah.
speaking of that, laser hair removal, it's a popular procedure, but there are many myths
Yes,
surrounding it. So can you demystify some of the common misconceptions
absolutely.
and
Yeah,
explain the
yes.
facts? Mhm.
Sure. So first misconception is that it gives you burns. No, nowadays the laser machines are so advanced that it doesn't give you any burn, and it is absolutely painless procedure. In fact, you experience more pain in waxing or threading or even while shaving. But now the equipments which are available for laser hair removal are completely painless lasers. Then
Okay.
so other myth is that when can I start it? So when you go for your waxing or threading, that is the time you should start it.
Okay.
Third myth is it safe on my face? So it is absolutely safe, because I have seen many patients that who keep on doing the about the lip area. They keep on removing hair by threading or by waxing. So those areas sometimes turn greenish or even blackish. This area, so therefore that is avoided with laser hair removal. So there are no side effects. There are a lot of misconceptions with laser hair removal, that there are side effects, whether I will grow my hair back, but you grow your hair back even when you are waxing or threading, right? Am I right?
Yeah. Yeah.
So yeah, so in fact, with laser hair removal or with laser hair reduction, the hair reduces to a level that you need not do your laser hair removal or any hair removal procedure for 2 months or 3 months also.
Wow. That's pretty
Yeah.
impressive. Now, I
Yeah.
guess anti-aging, it's a major concern for many people. So what are some of the most
Yes.
effective solutions, both in skincare and lifestyle changes, that you recommend to your patients?
Yes. So first we will start with skincare. Is that good? Anti-aging in skincare? Yeah. First of all, we need to understand that we are aging every second, every minute,
Yeah.
every moment we are aging. And that effect happens on our skin and especially our face. And that's why we say, face is the mirror of our whole body.
Right.
So, so that skincare we have to start taking very early in life. So, I will say, on your side of people, the skin is very thin and very sensitive to the sun also, compared to our skin. Yeah, yes, absolutely. Because we have more melanin, we are not that sensitive.
Right.
So you start aging very fast. So somebody should start taking care of their skin in their late 20s itself. So first, when you start taking care, you have to go for less invasive treatments like Botox is for the wrinkles, and it is absolutely safe. There is nothing to get scared with Botox. So Botox can be done for your forehead wrinkles, around your eyes, even for your chin, for your jawline, and it is absolutely safe. Then comes fillers. Now, fillers, there are natural fillers and artificial fillers. Fillers are hyaluronic acid, and natural fillers are your own fat.
Okay.
Have you heard of it? Autologous fat transfer.
Yeah.
So suppose you have sunken cheeks, or there is this area is sunken below your eyes. So that can be filled with your own fat. So that is autologous fat transfer, which is a natural element to fill your those areas. Then another one is artificial, as I said, is the hyaluronic acid. Then there is facelift. Now even there is facelift has evolved a lot over a period of time. Earlier, there was only major surgical facelift, where you had to lift the skin, cut the extra skin, and suture it. But now, if your face has not sagged too much, there's a procedure called as contour thread lift, wherein the threads are inserted in your below your skin, inside and also in the skin, and you get that lift. And there's another very big advantage of these threads is that they keep on secreting collagen.
Okay.
Which is the essential part of collagen, and elastin is the essential part of your skin, and which doesn't let it sag. So so this we have covered face, but also we have to take care of the skin of our body.
Right.
So how much skin exposure, sun exposure you would be doing, and even if you are exposing your skin or your body to sun, then you should be applying the sunblock, which is, and depending on the season there, and wherever you are living, and that if that is where you have to use either sun protective factor 50, 40, that you have to ask either your dermatologist, and they will advise you. So that is also very, very important part of your should be of your daily routine, I would say. Again, cleaning, coming to face and makeup, let me clarify one thing, that whenever you are going to sleep at night and if there is makeup on, please ensure that to take off your makeup, because your skin needs to breathe. So you should moisturize it, you should hydrate it, but no makeup and no cosmetic products should be there on the skin. So this is the skincare, I would say, in anti-aging. Of course, as we will be also covering anti-aging for your lifestyle diseases. So where food is a very important factor. So even you should eat healthy. If your gut is healthy, your skin will be also healthy. And same thing applies to the aging where lifestyle is considered. So where lifestyle aging is considered, now longevity is has become very important trend nowadays. If you would read or if you would see on TV, and which is very important because of the advancement in medicines, the population, the individuals are living for a very long life. 80 years, 90 years, 90 plus. So that is, if you want to live healthy, you have to eat healthy. You have to eat less junk food, eat natural vegetables, organic fruits, and also you have to eat organic meat. So this is the anti-aging in the lifestyle, and fitness is the most important part of the life if you want to avoid diseases, be it at any age. But of course, as you are aging, if you are overweight, if you are obese, then all you will definitely suffer from diseases like diabetes. Diabetes is an epidemic all over the world today. Then you will have hypertension, you will have heart problems. So first you should try and prevent it. There should be fitness. At least you should walk 40 minutes a day, and at least for 5 days a week. I think that's anybody can do that, and that is the anti-aging part of your lifestyle.
It's true when they say you are what you eat, and it's organic is very important because
Yes,
nowadays how much the food that we eat, I mean, how much garbage is in that food. It's like,
absolutely.
like
Yeah.
I eat like this can of, I don't really eat fish, but it's a can of chicken. That's
Hmm.
almost like tuna fish, but it's chicken breast. But that could sit in my cabinet for 3 years. What chicken lasts 3 years?
Absolutely.
There's so much
Absolutely.
garbage in that. So yeah, I
Yes,
mean,
the amount of preservatives and chemicals
yeah,
that are there in that. So it's always better to buy fresh chicken and cook it well
yeah,
and have it. Yes.
yeah. But even the fruits and vegetables, I mean, it's always sprayed
Yes,
with pesticides and
absolutely,
everything.
absolutely.
Yeah,
And all over the world, nobody has escaped from it.
I know.
Everywhere it is. Yeah.
Yeah.
Uh,
Now tell us, you've successfully reversed diabetes in several patients, including a former health minister of Maharashtra.
yes.
So can you talk about the approach to diabetes reversal and the steps involved in taking patients off anti-diabetes medicine?
Yeah. The first step is we find out what is their food pattern and what is their lifestyle. And of course, the blood test, that is HbA1c, their fasting blood sugar, fasting insulin. What happens, many of them are in insulin resistance. Now, what is insulin resistance? Insulin resistance is that whenever you eat something that gets converted into sugar, and that sugar is in the bloodstream. So, to control that sugar, the insulin is secreted in our body. So, more you eat or more sweet food you eat, more insulin will be secreted. The time comes, the cells don't need that insulin, and so the cells don't absorb the insulins, and then there is free insulin gets converted into fat and gets stored in your body. So we need to first find out whether that person is in insulin resistance, and what are the levels of their sugar, levels of their insulin, and levels of their HbA1c. Then comes the second part. It's what is their food pattern, how much they are eating, what time they are eating. Third is what kind of activity is they are doing. Are they only getting up in the morning, then going to the car, and from the car door to the office door and sitting in the office for 10 hours, or do they have any fitness routine? Number four, and most important, and many people will be surprised, is their sleep pattern,
Hmm.
which is the most important. Is sleep, and which we have taken it for granted now for last few decades. We think we don't need to sleep. So after considering all this, then we give them the we don't advise them to go off the medicines immediately.
Mhm.
First they need to, coming to food, so where we always advise them, intermittent fasting is the best way to eat less food and less calories also, and it also doesn't allow the body to secrete more sugar and to secrete more insulin. So we advise intermittent fasting. Should I explain what is intermittent fasting?
No, I think we understand it, but you can if you
I
want.
think yeah. So intermittent fasting is having 2 meals a day. So is where you delay your breakfast. You whenever you wake up, so there is 16 and 8. So you have 8 hours eating window, and then 16 hours you fast. So we advise them to go for that. So initially it's not easy to do remain fasting for 16 hours. I do it personally, but for so many people it is not easy. So we tell them to you go on 12 hours fasting, 12 hours eating window. Then we advise them to go for 14 hours fasting, and that's how. So what we do here is we first and foremost we reduce their meals. See, we don't even understand, we have breakfast in the morning, then we have fruit at around 11 a.m. Then again we have lunch, then again we have a sandwich, and again we have dinner. So there are at least 6 to 7 meals that we are consuming.
Right.
So we reduce their meals to 2 or max 3. The third meal will be a small meal. And after, so this is the food pattern. And then what do we advise them? We advise them to have more proteins in the diet. If somebody is a non-vegetarian, then we advise them to go eat eggs. You can even eat whole eggs. There is no problem. We advise them to have a lot of fish, chicken. Chicken, we always advise them to have free-range chicken. Not the chicken which is, farmed or locked in the small areas. So, but the free range chicken. Then we advise them to have goat meat, which is also quite healthy. So but somebody is vegetarian, then what kind of protein source they'll have? So we advise them to have pulses. Then we advise them to have cottage cheese. That is called paneer in India.
Okay.
Yes. So cheese is anybody can have. So that is also good. And we advise them to have low carbs. So carbs as less as possible. And here in India, we advise to have millets. I don't know if you have heard of ragi. Then there's sorghum. So these are the millets which is the food, and slowly and steadily it is getting popular all over the world.
Okay.
So what happens is millets, the glycemic index is much lower than wheat.
Okay.
And rice also. So we advise them to have millets. Then comes to their fitness part. So walking is mandatory. And along with that, we advise resistance training or weight training also. At least 3 days a week, weight training is advisable. And other days, the cardio, which can be walking, swimming, cycling. So that is what we advise. And as I said, sleep is also extremely, extremely important. Another thing I would add here is that nowadays we are seeing a lot of stress-induced diabetes.
Really? Oh.
Yes. There we advise them to do meditation every day. Yeah. So if you can be silent and be calm and be meditative, at least minimum 10 minutes a day. That is just 10 minutes in 24 hours. So all this, it's a comprehensive treatment program that we give. And that is how we reverse the diabetes. And it is very easy, and slowly and steadily. Then over a period of 3 months to 6 months, sometimes it may take 1 year also, if somebody is on injectable insulin or something. But somebody who is on tablets and we do these lifestyle changes, slowly and steadily we reduce their medicines, and that's how. And then we only when their sugars are normal, when their HbA1c has come below 6, then only we advise them to go off the medicine. But first and foremost is the lifestyle change.
Yeah, I guess that makes sense. If nothing else, they're becoming healthier by eating healthier, sleeping more, exercising.
Yes.
Start somewhere.
Yes, and it's not just the diabetes. All your other lifestyle diseases also get reversed. And if you don't have them, they get prevented.
Yeah. Well, I guess speaking of that, you mentioned hypertension is another area where you've seen success in reversal. So what strategies and treatments do you use to help patients manage and reverse hypertension?
Yes. So first, food is same like diabetes, and fitness is also same. Now somebody suppose is having hypertension. There we advise them for more even to do yoga. So yoga is the other day I was telling one on another podcast. See, in yoga, what you Western world knows is the exercise form. It's an exercise form. but that's not the fact. Yoga is a kind of lifestyle. So it is the when you wake up and then till you go to sleep. So it how calming and how calm you are, how you are able to control your mind. That is a major part of yoga. So in hypertension, we always advise them to go for yoga sessions, and also meditation is part of it. Along with meditation there is called as pranayama. Pranayama are the breathing exercises. Pranayama is a Sanskrit word. So prana is oxygen.
Okay.
So that is what we are breathing. So there are quite a few breathing exercises. So which also these exercises help us to reduce the pressure on your heart, pressure on your blood vessels, and it also helps you to calm your mind. So that's how we with the food, again the food pattern similar to how we treat diabetes, fitness pattern, and in hypertension majorly meditation and yoga and pranayama, breathing exercise.
Very nice. Now, I guess on
Yes.
another thing, acne treatments, they go beyond topical solutions. So what are some advanced
Yes.
treatments that you offer for acne, and how do they address the root causes of the condition?
Looking to grow your business beyond 5 figures, 6 figures, 7 figures plus, what I want you to do is go download this book. The title is called Be Good, Be Brief, Be Gone. It will help you grow your business past 5, 6, and 7 figure. Go download the book today, growfast.cash. I say again, growfast.cash, and download the book for absolutely free.
Yes. Now acne usually happens in the age group of, it can start from the 1, 5, 15 to sometimes I also see acne in the age of 30, 35 also. Okay. So then there are different methods of treating acne. Of course, and also again acne causes see, these are young children, they're high school going or they're college going, or they're just joining the university. So it causes lot of peer pressure. Oh, how will I look when I go to college? So there are many methods to treat them. One is the topical solution. Sometimes we also need to give them oral antibiotics, but there are laser treatments for acne, and so which are extremely effective. So that is those, we do those treatments also. And with the combination of oral medication, topical solutions, and laser treatments, and of course health of hygiene of your skin. So we have to advise them, because see, these are young children, they are sweating, they are going out, and
What
they're
they
not
eat.
washing their yes, not washing their face, and yes, what they eat is also important. So again, they will be eating junk food, they'll be eating chocolate. So we need to advise them that also eat vegetables, eat fruits. That too, again, as we said, organic. And with all this, it is definitely acne is completely curable.
Wow. Yeah, some people you see like it leaves scars on their face, like they've got really,
Yeah.
really bad so if there's a way to prevent it before that happens, by all means, people need to
Yes.
listen. Yeah.
Yes. And they sometimes you see those pitted scars.
Yeah.
Pits, small fine pits are there, and your face look. So even for that, laser resurfacing treatment is also available, where we
wow.
we do treat pitted scars also, and we can get rid of them. But as I said, it is always better to start the acne treatment early. Many times I see, parents tell children that no, it's a normal part of growing up, but
Yeah.
it's not that. Then those acne get converted into pitted scars. So it is always better to start treating them early.
Yeah, for sure. Now, I guess with cosmetic surgery, it definitely helps self-confidence. So how do you help your patients decide if cosmetic surgery is right for them, and what should they expect from the process?
Yeah. So what should they expect is comes first.
Yeah.
Yeah, before what is right. Because see, suppose if you take an example of rhinoplasty, that is a nose correction. So people have many images in mind, maybe some actor or maybe some personality, and they will say, oh, I want a nose like that. So which is not always possible. So that expectations are very important. So there is a of course, there are many counseling sessions happen before going for cosmetic surgery, because it's very important for them to understand what they will be going through and what they will be expecting and what they should expect. So, and what this is the result that they will get. So, after those counseling sessions, they are quite convinced, and that's how we do. Now, there are coming to cosmetic surgery. Sometimes it is not just for cosmetic purposes. So, suppose somebody is having a huge under eye bags. So, what happens is that is because of excess fat under their eye area. So that fat sometimes also keeps on pushing there and hurting their eye from inside. So that time also blepharoplasty is considered, but many times it comes under cosmetic surgery only. So many times it's not covered under insurance. Even liposuction or tummy tuck, it helps tremendously in weight loss and fat loss also. Because basically what happens when there is excess fat on your tummy area, what happens is it causes a lot of work or extra pressure on your heart. So when you take away that fat, first and foremost, your heart says thanks, thank you to you. Thank you for taking away that pressure from me. So yeah, so it becomes more than cosmetic. It becomes for your health and also your metabolic health, and to prevent your metabolic diseases.
Right.
So but again, as I said, it's a cosmetic surgery. Again, there also we have to do a lot of counseling, that how much approximately how many kgs will lose and how you will look. There is nothing like that you will have. Sometimes they expect I'll have a figure like this. So we have to explain to them that this is right now you are like this, so you'll become like this, and this much only is possible. We cannot take away too much of fat also. So all that is possible. Another advantage of having and doing all these cosmetic surgeries in India is that we don't have much waiting time.
Okay.
Yeah. And also we are almost at the 1/10 of the cost than the western countries. So that is a advantage, and our technology and our technique of surgery is as at par with the anywhere in the world, and they are very safe surgeries. In fact, if you talk about rhinoplasty, blepharoplasty, or facelift, they are the surgeries of almost they are called as office procedures. So you can do that and you can go home the same day. And especially contour thread lift, which I spoke about for the facelift, which is so it's a minimally invasive surgery. So that is called as lunch procedure. So you come during your lunch hour, yes, you get it done and you can go back to office.
Wow, amazing. And it's good that you
Yeah.
give the you have the consultation, because I notice like here in the US, every one of these doctors have the exact same photos, the before and after, before and after.
Yes.
Every doctor didn't do every one of these. They just buy these photos and they show it. But what works for one person might not work for you.
Yes.
So you have
True.
unrealistic expectations where you think, I'm going to look just like that because the doctor did it to someone else. Oh,
Yes.
he bought
Yes.
that photo. So
Yeah.
it's good to have realistic expectations and explain to them.
Absolutely. Absolutely. Yes.
Yeah, because nothing worse than putting in the time and effort, and I'm sure you have to be nervous and everything, and then you don't get the results you
Yes,
want.
yes,
Yeah.
yes, absolutely. Time, effort, and also money.
Yeah, for
Money
sure.
is also very important.
It's not
Yeah.
cheap. Yeah.
Yeah, not cheap. Yes. Of course, in India, it is much economical than in
Yeah.
other parts of the world. But still, so that's why I said there are a lot of counseling sessions happen before a person undergoes the surgery. There are 3, 4, 5, depending on the mindset of that person.
Right.
And that's what, that's what we do. And then everybody, we all are human beings, so everybody gets convinced. Yeah.
Good. Now tell us, holistic approaches to hair treatment, they're becoming more popular. So can you just discuss the different hair types and the various treatments you recommend to achieve optimal hair health?
Yes. Nowadays, and especially I'm seeing this after COVID,
Yeah.
the hair fall has increased. some stress levels among people have increased. Somebody has changed their jobs. Many people have, changed their careers also after COVID. So after that, we are seeing a large number of people who are having hair fall. Okay, so for hair health of your hair, again the food is very important. We should eat calcium rich foods. You should eat foods with the vitamins. You should eat eggs. You should eat fish. You should eat goat meat also, up to certain extent is very good. So and another very important, as I said, after COVID or even before COVID also, stress is a very major reason for hair fall. So another reason is thyroid. Somebody is hypothyroid also suffers from hair fall. So when somebody comes to us for hair problem, first and foremost we do all their hormone tests, all their blood tests, to see what is the root cause of the hair fall. Because unless until you don't find out the cause, and if you give them medication, what happens is you are not treated the cause, you are just treated the symptom.
Right.
So the cause remains as it is, then they might get better for some time, but then the problem will remain as it is.
Right.
So in fact, we are seeing people young as 26 and 24, we have to do hair transplant.
Wow.
Yes. Yeah. Recently, we have done a hair transplant for a 26-year-old doctor.
Oh my
He's
God.
a doctor, and now he has got a job in UK, in London. And in fact, he has flown to London just
Wow.
yesterday. Yeah. So, yes. And he lost all his hair during his medical college days.
Wow.
Because of stress.
Yeah.
And then, yes. So hair transplant, suppose somebody has lost quite a bit of hair, their baldness has happened, male pattern baldness, then among them hair transplant is a very good option. Again, hair transplant is your own natural hair. We take hair from your occipital part of your hair, and we transplant those hair roots, and then those hair roots grow naturally. It's your own hair which is growing, which you have to will have to cut eventually. How you cut your own hair, and how you'll have to wash it. So it's your own natural hair. So hair transplant has become a mainstay of the bald patches, and if there is male pattern hair loss, and it gives excellent result, because transplanted hair stays with you for life.
Oh wow.
Yes, transplanted hair always stays with you for life, and there are extremely good results with hair transplant.
Wow.
So that is one. Then there is another treatment which is become, and is the latest trend now, is PRP. It's plasma rich platelets, in which we take your own blood. That blood is processed, and then that processed blood is separated from plasma, and that plasma is then injected in your scalp. So it acts like new cells, and the new hair roots are generated.
Wow.
So
Modern technology.
Yes, and then that plasma can also be enriched with growth factor concentrate. It is called a GFC, growth factor concentrate treatment. Then there are a lot of hair proteins also available, and those hair proteins can be injected in your scalp, and the hair can be grown. So these are and along with that, we also give them oral multivitamins, oral calcium to take. And as I said, definitely we advise for everybody to have healthy food, fitness, and to manage your stress, manage or even get rid of your stress, and sleep.
You get the whole package. Nice.
Yes, absolutely.
Nice. Now, there are numerous skin treatment procedures available today. So how do you help patients understand the benefits and differences between these procedures to choose the best one for their needs?
Yeah. So as I said, and again, I have been saying that when the patient comes to us, first and foremost, we try to analyze and find out what is the cause of the problem, whether it is acne, or whether it is early aging, or whether it is hair fall, or whether it is obesity, excess weight gain. all these problems have a cause somewhere, underlying cause is there. So we try and find the underlying cause, whether there is hypothyroid is there, whether they have hormone imbalance. There are many girls coming with us with PCOD, that is polycystic ovarian disease or polycystic ovarian syndrome, which happens in the age group of 15 to 20, 25. Yes, as young as that. So we try to find out that first, what is the problem, and then we try and tell them these are the treatments available and this is kind of result you can expect, and that's how it helps them to choose. And when we, first of all, we educate them by showing them their own reports, showing them their values, and then we tell them this is the cause for your problem, and that these treatments are recommended for that. Then the choice is theirs, and that's how they choose it. Yeah.
That's good that you do that whole evaluation, because like I said, here,
Yes.
most people come, I don't like my nose, I don't like this, I don't like that, and fix it. And the doctor says, okay, cool, here's what it's going to cost. We'll fix it. Nobody goes through the whole procedure of, well, how did this happen? Let's figure out, is this the best way? Is this the only way? Here are your options. So that's good that you're doing all of that, because sometimes, like you said, it might not, it could be fixed by diet or by something else, but good stuff.
Yeah.
And,
because I'm sorry.
no,
Please go ahead.
Good.
Yeah. I've been practicing for 30 plus years. So today, in fact, somebody who had come to me for laser hair removal, their daughters are coming for laser hair removal now.
Wow.
So, yeah. So you have to, so that's how they remain with you for so long, because you have to be genuine. You cannot fool them. And, just do this procedure and go away. It doesn't happen like that.
Right. No, I mean, it definitely goes a long way, because you obviously care about them. So you want to give them what's best for them. And it repays you by sending more people, because it's like everybody recommends you now, or that word of mouth that, oh, this person was great, you need to go to them. So good stuff.
Yes.
Yeah.
Yes.
Now, anything else you want to talk about that we didn't cover?
Yeah. See, so many times, as I said, these cosmetic surgeries. In fact, there's surgeries like breast augmentation, breast reduction. Breast reduction is a huge problem. Somebody having large breasts, it's not just a cosmetic problem. I had a case that they were twin girls, and they both were doctors. They were medical doctors, and so they said, "Doctor, we are not come here to reduce the size of our breast because we want to look good, but it is because we cannot do jogging, we cannot do running, we cannot sleep on our tummy. So it is that hurting, and whenever we get periods, that is the time they are too painful. So people need to understand that this is not cosmetic. It is so take care of your physical health and mental health also. It's very, very important. Mental health is an important factor in all this we have spoken today. Because because of stress you get hair fall, because of stress you get acne, because of stress you get diabetes. So if your mental health is not right, you are going through some kind of trauma, whether it is a relationship trauma, whether it's your career trauma, you need to address it, and you need to understand before it takes over your body.
Yeah, 100%. I mean, it's all part of one machine. It has to work inside and out. Yeah,
exactly. Yes. And also, it's your body only where you are eating food.
Right.
That's becoming part of your body. Food is no longer a food, it becomes part of your body. So what you are putting inside your body is extremely, extremely important. People don't understand. People eat junk food because it is easily available, but where it is going to take you is you have to really see and work on it. And I would always I would not say advise, but I would like to suggest everybody, whoever is listening to this and seeing this podcast, is try to prevent diseases than curing them, and then going and eating so many pills every day. And it doesn't take much. Just eat less, eat healthy, and move more. Walk.
But what's funny is, like, we see this all the time where everybody's on a budget. you can go to McDonald's and get a greasy, fried, garbage food cheaper than it would cost you to buy healthy food. So sometimes people, like,
Yes.
especially with families, they'll just get the fast
Yes.
food because it's cheaper and they can afford that.
Cheaper.
But that's
Mm.
not what's good. And that's what makes it really hard. Like, even with organic food here, to be honest, it's sometimes almost double the price, and it's not even
Yes.
100% organic. I don't know how it is by you, but here the
Yeah.
law is it can still be a certain percentage not organic, but
Mm.
still qualify as organic.
True.
But it gets to the point where people can't afford to eat that way. Some people will just say, I don't care, it's about me, I'm going to do the right thing. But other people,
Yes.
they're like, I can't afford it, and they just eat the garbage. And it's like, but that's so bad for you.
Yeah.
And it's a shame because the government allows this stuff to happen. But that's a whole other story.
Absolutely. Yes, that's the other story. But whatever, how much you can afford, how much, at least you move more. That is in your hand. That doesn't cost money.
Mhm.
Running, jogging,
Yeah.
that doesn't cost money. That God has given us free. Sun is free. Sunlight is freely
Right.
available. Go out,
Yeah.
take sunlight. Sunlight helps in your mental health. So
Yeah.
I think that everybody can do. It
Well, it's
doesn't
always a
cost
tricky
money.
thing too, because it's like people will say it's always a big battle. People say, well, I can't afford to eat like that. But then these new shoes
Yes,
come out and it costs this much money. You have the money for that.
absolutely.
It's like,
Yes, yes, yeah,
yeah, but
absolutely.
but yes, we
Yeah.
are our vessel. We have to take the best care of it, and it starts with us. So
Yes,
I agree. But it's
yes,
nice to know all the options that are out there. Eek, stop.
absolutely. Yeah.
Nice. So how could
Mm.
people learn more about you or get in touch with you?
They can go to our visit our website. I think which is angelhealthcenter.com. Our number also I think we'll be putting in the description, right?
Yeah, I'm gonna
Yeah.
put it.
So yeah. So you can contact us on our website. That is angelhealthcenter.com, and we'll be very happy to help you whatever way we can. And we are here in Mumbai, and anybody can come in Mumbai if they want to undergo surgery, if they want to undergo any procedure. They should just let us know. And I would like to tell that we have a lot of international patients as well, and we take care of their everything once they contact us, right from their visa procedures to
Wow.
hotel accommodation to their surgical procedure or any other
Wow.
procedure. Yes, we take care of everything. We give a complete comprehensive package.
Wow, that's amazing.
Yeah,
And
and
for
all this, yes,
the difference in
yeah,
price, good place to go. Yeah.
yeah. Thank you.
No, good stuff.
Yeah,
Well, thanks
yeah.
again for being on the show. Again, that was Pornima Mhatray. So thanks for listening to Successful Minds with Patty B. Never miss an episode by subscribing to the show. So thank you again.
Thank you, Patricia. This
My
was
pleasure.
lovely speaking to you.
Likewise.
Like.
Hey, we all want to scale our business. Hey, I have the answer for you today to help you do that. If you're looking to scale from 5, 6, even 7 figures and beyond, book called Be Good, Be Brief, Be Gone. I'm going to give it to you for free. All you have to do is type in growfast.cash. I say again, growfast.cash, and you can download the book for absolutely free. I hope the book helps you this year. Take your business to the next level. Again, go grab the book, growfast.cash. I say again, growfast.cash. I wish you the best and grow, scale, and win.
Thank you for listening to Successful Minds with your host, Patricia Barnowski-Schneider. Please leave your feedback and visit strategicadvisorboard.com to get the latest and greatest business advisement on the planet. Follow us on social media for updates, and we'll see you on the next episode.
There me! That's what I've been waiting for! Dear God, it's beautiful.